Hi, my name's Rachel Allen and I'm an Aboriginal health practitioner. I'm here to take you through the 715 health check for Aboriginal and Torres Strait Islander people aged 25 to 49 years. Let's start by going through what a good health check should include. A good health check is useful to the patient, identifies health needs including patient health goals and priorities, supports patients to take charge of their health and well-being, provides a framework for primary and secondary disease prevention through healthcare advice, risk assessment and other measures, is provided by the regular healthcare provider, includes a plan for follow-up of identified health needs, priorities and goals. You can also check through HPOS, the health professional online service, if a patient is eligible for a health check. The information we are supplying is very comprehensive and may be overwhelming. Some of this information you may already have pre-existing knowledge of and may not need to ask all the suggested information. As a health practitioner, you have a legal obligation to provide patients or substituted decision makers, such as parents and carers, with information, including discussion of the process and benefits of their health check. Consent processes promote patient-centered care that's respectful of and responsive to patients' individual preferences, needs and values, and ensures that the patient's values guide all clinical decisions. Consent processes promote cultural responsiveness in health services, thereby improving the capacity to respond to the healthcare needs of culturally and linguistically diverse communities. When undertaking a health check, you may also need to gain consent for sharing information with relevant healthcare providers. For some people, this may include support workers or carers, WorkCover, job services, Centrelink, Services New South Wales, or specialists. You should also ask your patients to provide the names of workers, organisations, and their contact details of any other providers involved in their care, and document this in the patient's file. Patient details can be completed by a practice nurse. For patients who've already been to our service, we still need to ensure all identifying data is up to date and correct. When updating patient details, you should ensure Indigenous status has been recorded correctly by asking the patient, are you of Aboriginal or Torres Strait Islander origin? You should ask the Indigenous origin question even when a response has been previously recorded to ensure it's been recorded correctly. Once a Medicare number is provided, you can also register the patient for Closing the Gap PBS Copayment Measure, or CTG, for cheaper prescription medication if they aren't already registered. While collecting patient details, you should also ask if they have children or if they're responsible for caring for someone else. You can also ask your patient if they have a carer for themselves. This is particularly relevant for patients with a disability. Current health and patient problems can be completed by a practice nurse. As you begin the health check, ask the patient, what are the important things for you in this health check today? And is there anything you're worried about with your health or well-being? This is a good way to gauge their priorities for the health check. You should also ask if the patient has any specific health goals. Is there anything about their health and well-being they'd like to improve? This could include weight loss, counselling, or seeing a dietitian. Medical history and current problems can be completed by a practice nurse. It's vital to understand the current medical history of your patient. Ask the patient, carer or parent, is there a history of or current problems with any common conditions? For example, cardiovascular disease, blood pressure, diabetes, obesity, renal failure, hearing loss, mental health or suicide, respiratory disease, headaches or migraines, heart attacks or strokes. Acute rheumatic fever and rheumatic heart disease are notifiable conditions in New South Wales and must be reported to New South Wales Health. You should also ask about details of your patient's mental health, including any history of depression or anxiety. Have they had any hospital admissions or operations? If so, when, what for, and did they require follow-up? Has this follow-up been attended or is it still ongoing? Is there any other relevant medical history? Regular medications can be completed by a practice nurse or GP. It's important to know if the patient takes any regular medication. This could include prescribed medicines, such as a puffer or contraceptive, or over-the-counter medicines, such as Panadol. It's important to include traditional or bush medicine, or complementary and alternative medicine, such as vitamins, as these may interact with prescribed medications. When discussing medications, it's important that you check if the medication is still required, if you're giving the appropriate dose, and that they're taking it when and how they're supposed to. An example could be if a patient's been prescribed a preventer, are they taking this daily or only when experiencing side effects? And are they using a spacer to administer the correct amount? You may need to provide education about using and cleaning medical aids and ensuring medication is taken as prescribed. You should always make sure your patient's medication usage is documented in their clinical record. Allergies and adverse reactions can be completed by a practice nurse or GP. Recording allergies and adverse reactions is an important KPI and is also important when considering prescribing medications and therapies. Is the patient aware of any allergies or adverse reactions they've had? Do they break out in a rash when given a certain medication? Are they allergic to bees, or do they need an EpiPen? Relevant family history can be completed by a practice nurse. Ask the patient about any significant illnesses that have a strong familial predisposition, such as breast cancer, bowel cancer, prostate cancer, ovarian cancer, ischemic heart disease, diabetes, hypertension, stroke, glaucoma, or mental health is important. You should ask and include the age of onset if known. For example, Nan on mum's side was diagnosed with type 2 diabetes when she was about 50. She had to have a toe amputated when she was about 70. This family history gives you an idea of what your patients are at risk of and things to screen for and to keep an eye on as our patients get older. The social and emotional wellbeing section can be completed by a practice nurse or GP. Ask your patients, in general terms, how they're doing. When they're feeling down, what do they normally do to try and cheer themselves up? Do they exercise, go for a walk, listen to music, or call a friend? Are they using more unhelpful methods like drinking alcohol or taking drugs? The home and family section can be completed by a practice nurse. It's important to establish what home and family life looks like for the patient by asking some simple questions. You can ask the patient, who do they live with? Who else lives in the household? You can ask about other relatives or friends that may be living or staying at the house. Are they renting or are they the homeowner? Do they have stable housing? Are they sleeping rough or couch surfing? And do they feel safe at home? Some of your patients may be staying in emergency housing. If any red flags are raised here, you should document and report accordingly. Reporting can relate to violence, abuse, and neglect. The Department of Communities and Justice has a number of reporting lines. You may need to refer to social workers or housing services. For patients who may be parents, you should also ask about sleeping arrangements. Do they co-sleep with their babies or children? If parents tell you they're co-sleeping with their babies and young children, it's important not to shame them. Let them know that the safest option for baby is to sleep in a cot next to their parents' or carer's bed for the first 6 months to 1 year of their life. However, be aware that parents and carers may choose to co-sleep for several reasons, including making it easier to breastfeed and resettle during the night, a sense of safety and security, or overcrowding at home. You should make sure parents and carers are aware of the dangers of co-sleeping and ensure they're minimising the risk if they do continue to co-sleep. The learning and work section can be completed by a practice nurse. You can ask your patient if they're working. If they are, what kind of work are they doing? Are they full-time or part-time? If they're not working, you can ask if they're receiving any Centrelink payments, such as job seeker allowance or parenting pension. This is not to judge anyone, just to make sure our patients are getting an income from somewhere. Is your patient studying at TAFE or uni? What are they studying, or have they studied previously? The mood section can be completed by a practice nurse or GP. Establishing mood is important. Ask the patient how they're feeling, and do they feel like they have a good group of family or friends around them? Are there times when they feel depressed or down for long periods of time? Are they worried or stressed often? When they're feeling depressed or anxious, do they feel like they have someone they can reach out to, like a family member or a health worker? When they're feeling down, what do they normally do to try and cheer themselves up? Do they exercise, go for a walk, listen to music, or call a friend? Or are they using more unhelpful methods like drinking alcohol or taking drugs? How does their mental health affect their social life, employment, and relationships, such as with their partner or children? You can use tools for psychological interviewing, such as K5 or K10, to screen for any social and emotional wellbeing red flags. If you are worried about your patient, you can offer or refer to counselling services, psychologists, or provide them with numbers for hotlines, such as Beyond Blue, Headspace, Suicide Callback Service, or Lifeline. Ask your patients if there have been any stressful life events that have been impacting on them or their health lately. This could include job stress, financial difficulties, or breakdowns of relationships. Healthy eating, exercise, screen time, and social connection can be completed by a practice nurse. Establishing patterns with the patient around healthy eating, exercise, screen time, and social connection is essential. Does your patient have any worries or concerns about their diet or weight? Keep in mind, some women may have some unhealthy or unrealistic ideas about their weight. You also need to think about any patients who may be very underweight. Have a conversation about healthy eating and drinking, recommended fruit and vegetable intake, and avoiding sugary drinks. This includes juices and cordials as well as soft drink. Ask how often the family or person have takeaway. Is it a treat or a Friday night meal, or are they having it regularly throughout the week? You can ask your patients how confident they are with cooking. Some patients may be eating a lot of takeaway as they lack knowledge and confidence in the kitchen, or could feel like they're too busy with kids and work. You could suggest printing off some quick and easy healthy recipes for them to take home and try. A question that we need to ask is about the availability of food. An easy way to ask this question is to ask, has there ever been a time when you've run out of food and haven't had enough money to buy more? Once again, you're not here to shame people. If they answer yes, then we need to help them find support. They may need a referral to a food assistance program such as Anglicare or a food bank. Ask your patients if there's anything they're worried about with their level of physical activity. For adults, it can feel especially hard to stay active if you're no longer involved in a sports team or you feel tired after work. Adults should be doing 2 to 5 hours of physical, moderate exercise per week. This could include playing a game outside with the kids, walking to and from work, or hitting the gym after work. Is there anything your patient's worried about with their level of screen time? We want to make sure we're balancing out screen time with enough physical activity. It can be helpful to be mindful of the amount of time we're spending on screens, and it's good to encourage a break every 30 minutes or so. Substance use, including tobacco, can be completed by a practice nurse. Recording smoking status is a national KPI. If someone tells you they're a current smoker, you should also find out how many cigarettes a day they smoke and how long they've been smoking for. This is an excellent opportunity to provide brief intervention and ask them if they're interested in quitting or cutting down. If a patient is interested in quitting, your service may be able to provide nicotine replacement therapy, or NRT, and education on the spot, or may refer them to a pharmacy. If your patient would like to quit and accepts the NRT or referral, it's a good idea to check in with them in about a week or so. This is as easy as a phone call to see how they're doing with their quit attempt. If your patient's not interested in quitting, you can leave it for now and continue to ask at subsequent appointments. You can let people know that if they change their mind, to give you a call back or come and see you. Alcohol and other substances can be completed by a practice nurse. Recording substance use is another important KPI. You should ask your patients about the quantity and frequency in which they're using the following. Alcohol. If yes, how much and how often do they drink? Also record caffeine, coffee or energy drinks, and cannabis, also known as weed, yandi or ganja, or any other substance use such as IV drugs, methamphetamine or opiates. It may help to explain you need to ask about substance use, as some medications will not mix well with some drugs, and you need to be careful when writing them prescriptions. You may refer your patients to alcohol and other drug counsellors if they'd like help. The gambling section can be completed by a practice nurse. In regards to gambling, it's good to ask questions like, have you or someone close to you ever had problems with gambling? Again, you may refer your patients for counselling if this is something they want help with. The genitourinary and sexual health section can be completed by a practice nurse or a GP. Here, we're asking patients about their sexual activity, contraception, safe sex, and protection. You may also ask about sexual orientation and gender identity if this is something your patient feels comfortable talking to you about. If your patients are engaging in sexual activity, we should talk to them about contraception and protection, such as the pill, the IUD, and condoms. Patients who are signed up to the CTG can access prescription medication such as the oral contraceptive pill for lower cost. You can ask if there's anything they're worried about or concerned about in relation to their sexual health. You should also ask your patient when their last STI check was. You may want to offer an STI screen, a urine test, or a blood test, and talk about the warning signs of STIs. For your female patients, you should ask when they last had their pap smear or cervical screening test. You should be offering the cervical screening test to all female patients 25 years and older. Patients may be due to have a repeat CST, but that will depend on the result of their last test. If it's been more than 5 years, you should proceed with the test. For your female patients, you can ask about their menstruation history. Have they ever had any issues with their period? Are they experiencing issues with incontinence? You may also have a conversation about menopause for women who are experiencing it, or younger women who may have some concerns. For your male patients, you can discuss any continence issues or if they experience nocturia, waking up in the night to urinate. You may also have a conversation about erectile dysfunction. It's very important to remember that men and women may only feel comfortable talking to a health worker, nurse, or doctor of the same sex or gender in regards to men and women's business. Cultural sensitivity should be front of mind when having these conversations. Immunisations can be completed by a practice nurse or GP. Health practitioners should use the Australian Immunisation Register to make sure your patient's immunisations are up to date. We also want to make sure the immunisation register matches what's recorded in the patient's medical record. If your patient or someone close to them are pregnant, they should let the health worker, doctor, or nurse know so they can check if their tetanus, diphtheria, and whooping cough booster is up to date. As always, we encourage everyone over the age of 6 months to get an annual flu vaccine. The flu vaccine is usually provided for free for Aboriginal and Torres Strait Islander patients. Eye health can be completed by a practice nurse. Is there anything the patient's worried about with their eyes or vision? You could ask them if they have any issues seeing the TV, reading, or using screens on their phones or tablet. You may notice that if people are studying or working office jobs, they may begin to experience eye strain. Do they already wear glasses? If so, is it for distance or near vision? If they already wear glasses, have they seen the optometrist in the last 2 years? Aboriginal and Torres Strait Islander people experience vision impairment and blindness 3 times more than non-Indigenous people. Programs such as the Brian Holden Vision Institute can assist Aboriginal and Torres Strait Islander people with low income to access glasses. If your patient has diabetes, you should be following them up with eye health checks every 6 to 12 months and keep a close eye on conditions such as diabetic retinopathy, glaucoma, and cataracts. Ear health and hearing can be completed by a practice nurse. Is there anything your patient's worried about with their listening? Do they find themselves saying huh or what a lot? Do they struggle to hear the TV or people on the phone? Have they had a hearing check before? Some patients may work in occupations that expose them to hearing loss, such as working with heavy machinery. Aboriginal and Torres Strait Islander people have some of the highest rates of ear and hearing problems in the world. This can affect speech, behavioural problems, and education, and have long-lasting effects that create hearing loss or other problems as they become adults. It can be helpful to ask your patients if they have a history of hearing or ear problems, such as recurring ear infections, either as an adult or when they were children. You should also use otoscopy to look for wax, perforation, red or bulging eardrums, retracted eardrums, or any discharge coming from the ear. If you notice anything abnormal, you should refer them on to an audiologist or ENT. Oral and dental health can be completed by a practice nurse. In regards to oral and dental health, is there anything the patient's concerned about with their teeth or mouth? When we're talking about their teeth, we want to talk about things like, are they brushing their teeth regularly, twice a day, and are they using a soft, small toothbrush to get their teeth and gums? It can sometimes help to have a stock of appropriate toothbrushes to hand out as part of your health check. Is there anything your patient's worried about with their teeth? Has the patient noticed any dark spots, cavities, or rotting teeth? When was their last dental checkup? Do they need a referral for a dental review for fillings or extraction? Does your patient have or require dentures? If they do have dentures, do they fit properly? Does your patient experience any difficulty in swallowing or chewing their food? You should also be mindful of food and drinks that can cause damage to their teeth, such as sugary foods, soft drinks, and juices. You should encourage fruit, veggies, and dairy products such as cheese and yogurt to keep their teeth healthy and strong. As you encourage our young people to participate in sports activities, you should make sure they're seeing the dentist to get a mouthguard fitted for them, especially if they're playing contact sports like football. You don't just want to look at teeth. You may also ask about bleeding or swollen gums, cold sores, ulcers, or rashes around the mouth. Skin checks can be completed by a practice nurse or GP. In regards to skincare, you should talk to patients about sun safety, especially if they're working outside or spending a lot of time in the sun. Your patients may also have moles or sunspots that they're worried about. You can monitor these, warn about changes, or refer to a skin specialist. The examination section can be completed by the GP. During a standard and thorough examination, this is where you'll be taking your patient's physical measurements. It's always polite to let them know you may need to physically touch them for these examinations, such as waist measurement. You should record their height, weight, and BMI. Recording weight is required for the PIP Quality Improvement Incentive payment. You should also record blood glucose levels, blood pressure, heart rate, and rhythm. Once you've recorded this data in your patient's record, you can also order a blood test for cholesterol and use this to calculate your patient's absolute cardiovascular risk. Absolute risk is your chance as an individual of getting cardiovascular disease, which includes all heart, stroke, and blood vessel diseases. Aboriginal and Torres Strait Islander patients over the age of 35 years can use the absolute risk calculator to find out their chance of stroke, heart, or blood vessel disease in the next 5 years. Cardiovascular risk is calculated by looking at risk factors, including your blood pressure and cholesterol. Absolute cardiovascular risk calculation is another important step for our PIP Quality Improvement Incentive and is valuable in helping patients understand their individual risk and taking steps with their health practitioner to monitor and make healthy changes where possible, such as losing weight or quitting smoking. The investigation sections should be completed by the GP. STI screening is recommended from age 15 or could be considered for 12 years if indicated. You may also screen for blood-borne viruses such as Hep B, Hep C, or HIV. You can also request blood tests such as full blood count, HbA1c, lipids, kidney function, liver function, and urine ACR for those 18 years and over. Finalising the health check should be completed by the GP. To finalise our health checks, you should check in with your patient to gauge what they think are the most important parts to come out of the health check. You can reiterate the brief intervention and advice you provided during the health check, such as information and advice around smoking, exercise, and sexual health. You should document any care provided as part of the health check, such as immunisations or investigations requested. You should talk to your patients about any needs or new diagnoses you've discovered through the health check and plans to manage or treat these findings. You should consider what follow-up appointments need to be made, such as reviews. If possible, you should encourage your patients to rebook for future appointments while you have them at the clinic. You may also be able to arrange transport to assist them in getting to the appointment. If you've made a referral to another specialist, make sure you remind the patient why we're making this referral. It's more likely for someone to attend a follow-up appointment if they understand why they're there. Sometimes it can help patients if you assist with booking appointments for those referrals. This could be calling up a specialist on behalf of the patient while they're there with you and booking the appointment for them. You should make sure you enter any recalls into the patient's medical record. This could include a date for their next health check, any immunisations due, or follow-up after referral or investigations. To conclude the health check, you should always offer your patients a copy of their health check report. Some patients may decline a copy. That's fine, but you should always ask. Finally, you should claim PBS item number 715 to submit their health check to Medicare and receive the Practice Incentives Payment Indigenous Health Incentive. This concludes our module on Aboriginal and Torres Strait Islander health checks for people aged 25 to 49 years. Thank you.